10% on average in each state. In the case of Ohio, that would mean at least 700,000 people have antibodies.
Here it is.
Prior to shutting down schools and businesses.
The news
Despite
about the
this,
coronavirus.
A mass surge in hospitalization.
That's right.
That threatened to overwhelm
The news
our
about the
capacity
coronavirus.
before lockdown started. And based on Dr. Acton's early projections, the early antibody testing, and the recent national antibody studies, when you combine that with 22 major countries in Europe and elsewhere that sent kids back to school in May and reported zero spikes in transmission from kids to adults, it seems that all scientific indicators show us that while we may see periodic spikes in sickness and even some deaths, that there simply is no justification for any ongoing government interference in normal school and business activities. There's more negative impact to kids through hybrid schedules, or in the case of Columbus City Schools, the recommendation that high school-aged learning be online. Governor, the public wants to know, how can we justify an ongoing declaration of a health emergency based on small upticks in sickness or hospitalization that's not close to threatening our hospital capacity? Secondly, could you update us on the results of the antibody study? And does it make sense to say that 700,000 Ohioans, minus those who passed away prior to March, should be considered recovered as well?
Well, Jack, thank you. I've asked the Lieutenant Governor to look into this whole area, but let me just start by saying a couple of things. Kids should go back to school. That's the whole thrust of what we said today. And you pointed out some of the dangers, and the pediatricians have pointed out some of the dangers of having kids not in school. And so we certainly agree that kids need to go back to school. We're going to continue to monitor the hospital numbers. I don't think that even you and I would disagree with what the hospital numbers are.
Here it
these
is.
Come from each hospital. Where
The
they tell you
news about the
basically how many beds
coronavirus.
they have in ICU left and how many beds they have.
That's right.
General beds
The
they
news
have.
about the
And
coronavirus.
so we're going to continue to monitor that. We are certainly seeing an uptick in central Ohio, which means the Columbus, basically, the Columbus hospitals, at least for the people who are more sick. Many of them will end up in the Columbus hospital. So we're going to continue to monitor those. We're seeing certainly an uptick there. John?
Yeah, thanks, Governor. And Jack, let's hope that our immunity is broader than what the statistics would indicate that it is right now. But we have tried to have that fine line between, look, here's the best way to protect us. Let's get businesses open. Let's people go back to school. And do it in a way that offers as few mandates as possible, but the best recommendations on how we can actively keep ourselves from spreading the coronavirus, which could lead to some of those restrictions needing to be considered for the future. But on the prevalence study test, we had some changes at the Department of Health. The medical director, we have a new medical director. The new medical director has gone back through with the team to ensure that they're comfortable with the test methodology and practice, and we are moving forward, I've been told, with letters that will go out next week to households, to specific areas, to begin the process of that 30 by 30 antibody testing in Ohio. It's been delayed. I can tell you that I wish it had happened earlier than this. I worked very hard with NetJets and others to get the antibody test from China to us so that we could do more of those kinds of things. That is moving forward. Let's hope that we get better news than perhaps the data shows us right now. And when that test is done, hopefully Ohio will be in better shape. But as of right now, the data is the data. It does show us going up in some areas. It does show hospitalizations go up. It does show ICUs going up. It's a trend. Nothing in the presentation today was a mandate. It was just telling people, look, you've got to do the things that get us through this so we don't go backwards, so we can balance the health and economic aspects. And I think that's what we all want. I know that there's a disagreement a lot of times in our society. You can hear it just in this press conference. Some people want masks and mandates. Some people want less masks and mandates. That's the greatness of America. We're having that debate. Now we're getting to do it at the local level, where we're going to get some buy-in on this that we think will help make people feel better about what's happening and probably do a better job of controlling spread in their communities. And we'll get you that information on the 30 by 30 testing. I'll push to make sure we get it as soon as possible.
Governor Tom Gallup of Gongor News Service. As we see more states such as Pennsylvania enacting a statewide mask mandate, how will the results we see out of those states influence your decision on a potential statewide mandate going forward?
Well, as you know, we certainly looked at that statewide mandate, and I felt that at least at that time, large number of Ohioans would not accept being told to wear a mask. We are doing absolutely everything we can, and I'm sure that people who hear me talk get sick of me talking about the mask, but we're doing everything we can. We have, as we announced the other day, we have a very significant TV campaign on health professionals talking directly to the people of the state of Ohio about what the importance of wearing a mask, the importance of washing your hands, the importance of keeping the distance. My belief is that healthcare workers are a lot more credible than politicians, and so that's why you see some of the health professionals on TV doing it, and not me. These are people who are credible, and almost virtually to a person, they will tell you and tell the people of the state of Ohio the importance of doing those things. So we're looking at other programs. For example, in Cincinnati, Mayor Cranley today is working with some of the business community, and the county commissioners are working with some of the business community. Procter & Gamble supplying a mask to have a kind of a grassroots effort in Cincinnati to get people to wear masks, to make them available outside of restaurants, outside of places. This is what we really need throughout the state of Ohio, is this grassroots effort from people who are trying to slow this virus down, and by people who fully understand that we cannot move this economy forward unless we slow this virus down. So in regard to Pennsylvania, I'm looking to see what any other state is doing, how anything is actually working. But our efforts have been really intensified in the last week in regard to getting our fellow Ohioans to wear these masks. It's already mandated inside business. When you walk into a store, that business, the men and women who work there are wearing a mask for you, and all of us, when we go in, I think should wear a mask for those individuals. It is, it's not an ideological issue.
Here it is.
It's not
the news
question
about
of
the
freedom.
coronavirus.
In fact, what the mask does, whether it's an Indians or
That's
Reds
right.
or 4th of July mask, whatever it is,
The news
it
about
gives
the
us more freedom. It
coronavirus.
gives us the ability to go around, and it's just the right thing to do. So we're not letting up. We're increasing, and it's important. Ohioans, we control this. We control our destiny.
The history to that, because we the end of April, beginning of May, we looked at this, and just want to recall some of the things we heard at that time. We heard it from retailers and businesses about customers, don't force us to implement your mandate. How are you going to police this? Who's going to enforce it? We heard that, and we had even situations in other states where employees who tried to enforce it, there was violence involved and things like that. And remember, there are legitimate reasons that some people can't wear a mask. We heard from parents of autistic children. We heard from people who had health issues, respiratory issues, who couldn't wear a mask. It's very difficult to know who's out, who's in, who has an excuse, who doesn't. But as Dr. Acton always used to say when she was here, if we get this 80% right, it's like Swiss cheese. We do this, we do that. It all adds up, and that's what collectively we can do. If most people do this, and it's becoming more socially acceptable, more people are moving to this, and I feel a sense of that people are doing the right things. That masks are, everybody recognizes how important they are, and we are building that capacity, and businesses are stepping up, communities are stepping up. I know that the mayor of Dayton and the city of Dayton work with the Dayton Chamber of Commerce to try to make sure that their ordinance made sense, so about who enforces it, how do you get it right. those are good conversations to have with this localized system to make sure that they're practical and enforceable, and that people feel good about how it's happening. So I think that you're going to see a bigger embrace from business and the public and the local communities in the manner in which this is progressing, because you get localized solutions to localized problems, that people have a buy-in, and that masks are going to be more widely adopted as people see the increases going forward.
Good afternoon, Noah Blendo with Hannah News Service. Governor, I'm wondering what your interpretation is of the local public health jurisdiction on state property and state facilities. If Mayor Ginther institutes a mask mandate, does that mean people in the Rife Center or in the State House should be following those orders? And likewise in other jurisdictions across the state where there might be state property, state facilities?
Well, I would certainly hope, first of all, anyone that works for me will follow them. I'm not going to try to play lawyer up here, and 'cause I have not done the research on that, but I certainly hope that everyone will follow those orders. They're not unreasonable orders. They're very, very, very reasonable. And my understanding is that it applies when someone walks in a building, and they should follow that. Most our orders, for example, in regard to employees, if you're in the office by yourself, you take your mask off, of course. So somebody working in the right building or something soon has the ability to take their mask off if they're in their office by themselves. So a lot of this is common sense. I want to congratulate the mayor and all the mayors for doing this. I think it makes eminent sense to do it. And again, I'll go back maybe to a previous question or so ago. But if you look at what we highly recommend in schools, 3rd grade and up, certainly highly recommend that. Some schools will be doing the mask at an earlier age, some may not be, but look, these are things that we all can do.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. I'm wondering if you could talk a little bit more about the counties that border the counties that are red. Should people be concerned if they're bordering the counties that are red? And how does that data maybe go back and forth between?
To ask Eric to put the map up, I'm sorry, didn't mean to interrupt you. Go ahead.
How does that data go back and forth? Maybe is it possible that somebody is actually living in Warren County but then went to Hamilton County, was diagnosed in Hamilton County, things like that?
I mean, basically, the data is driven by county of residence, with the exception of the one indicator which we looked at from a regional point of view. So if you live in London, Ohio, and Madison County, and you end up in the hospital in Columbus, that when you're looking at hospital capacity, they look at it by the county where the hospital is. But if you're looking at it by any other indicator, hospital admissions, for example, it would be attributable to Madison County. So they try to make sense of this as far as what would be make the most sense. And we try to drive things based upon your residence. Now, if someone, I can make up a hypothetical, let's say someone went to a party in Columbus and they live in Madison County, and the tracer turns out to find they got it in Columbus, I assume that they're still going to show up in Madison County. And that's what you find. We had a funeral, and we had a bunch of people in one county, but then a bunch of people came from another county. So you report the outbreak in one county, but if you look at the numbers where they're attributable to, you're going to go back to wherever that person is from, which is certainly could be a neighboring county. Answers are not, Andy. Thank you.
Hi, Governor. It's Andrew Welsh Huggins with the Associated Press, and I am today's last question. I just wondered if you could say or talk a little bit more about how much money you think might be available for school districts to help with their reopening. And I'm also just wondering hindsight being 2020, would it have been better not to cut schools in the initial set of budget cuts, anticipating this need now?
What we're trying to do is, look, no one wanted to cut the schools. Certainly, I didn't want to cut the schools. We come 3.7%. We wanted to do that early because we wanted schools to be able to have basically a flat funding from then on. And so, you know, our goal is to keep that funding at that new level until we get enough revenue in that we can raise them. But it's trying to bring some continuity to the schools. But I started looking around and I said, look, this is going to cost, you know, these things that schools are all going to do to try to put kids back in the classroom. It's not cheap. You know, they're going to have hand sanitizer, and that's probably the least of their cost. You know, they got other costs involved. And so we need to try to take some of the CARES money the federal government sent to try to give them some of that money. So I've learned, I would love to give you a figure. I have a figure in mind, but until I really talk, you know, with the leadership of the legislature, it probably would not be good for me to give that number. It will not be enough to do everything that needs to be done, but it will be significant enough money that I think people will cash the check anyway. Thank you very much. Happy 4th of July, happy Independence Day to everyone. Hope you have a great time with your family, and everybody enjoy the celebration of our absolutely wonderful country. I've seen some of the things on TV, some of the celebrations that are going to occur, and people with stars, and we're going to see fireworks and a lot of things where people, you know, can stay safe, but really have the opportunity to enjoy it. And I know some of the communities are having very, very safe fireworks. You can sit in your car and do things like that. So have a good time, and we'll look forward to talking with you all next week. Thank you very much.
Okay, and you were just listening to Governor Mike DeWine updating us on the latest from his office's efforts to combat the coronavirus. The governor began today's press conference revealing the state's coronavirus information website has been targeted by hackers and has been temporarily disabled. Some more information we learned today. He unveiled a health and safety guidance for Ohio's K-12 schools ahead of reopening the schools in the fall. DeWine announcing a collaboration with Ohio House Speaker Larry Householder and Senate President Larry Obhoff to create a funding package to help school districts reopen campuses and purchase supplies to keep staff and students safe from COVID-19. He's committed to keeping wellness dollars in the state education budget for as long as he's governor, but pointed out his reliance on the legislature to agree with his policy. Also, the governor unveiled the Public Health Advisory Alert System as a coordination effort for messaging from his office through counties and cities and reaching all Ohioans. Our State House reporter Molly Martinez was at that briefing. We'll have much more coming up later here on Spectrum News 1.
High heat continues to be our big weather story heading into the long holiday weekend. Afternoon highs tomorrow will approach the mid-90s in some spots. Now, if there's one positive out of this forecast, of course, those are very hot temperatures just alone, but the humidity is not going to be incredibly high. So that 95 is going to feel like 95 out there. A slight chance for an isolated pop-up or two, especially for the northern half of the state on Friday afternoon, but it is going to be a pretty dry, sunny, and hot weekend. No rain showers out there today. Just some really hot temperatures. We're talking about upper 80s and low 90s for afternoon highs with lots of sunshine. Skies stay dry through the overnight hours. Temperatures mild in the 60s to around 70 degrees. And there they are heading into tomorrow afternoon. We are talking about low and mid 90s for an afternoon high. An isolated pop-up or two in the afternoon, again, especially north of I-70. Your next weather on the ones in less than 10 minutes.
This just in, Columbus Mayor Andrew Ginther will sign an executive order mandating the use of facial coverings. Mayor Ginther will sign the order Friday, which will require people in the city of Columbus to have facial coverings while in public places. The announcement comes following the largest case jump yesterday since April. Franklin County has the highest number of cases by county in the state, and we'll have more on the mayor's announcement coming up later on Spectrum News 1. Cincinnati has now joined the list of cities in the process of requiring masks in the effort to stop the spread of COVID-19. City Council will take up the issue at an emergency meeting Friday morning. Mayor John Cranley says coronavirus cases in Cincinnati are trending in the wrong direction.
Masks are our best hope to keep the economy afloat and to keep people safe.
Unlike Dayton's new ordinance covering indoor and many outdoor locations, Mayor Cranley says he supports an indoor-only requirement. He says City Council is drafting the proposal. Ohio Democrats and doctors are banding together for a renewed push to require face coverings for everyone in public places. Several physicians from around the state joined one legislator from the Columbus area on a Wednesday conference call hosted by the Ohio Democratic Party. Medical professionals say using face coverings does more to protect others from catching COVID-19 if the person wearing the mask has the virus and is asymptomatic. Some doctors are also pushing for paid sick leave and increased testing as two measures of keeping the virus from spreading and accelerating. A Cleveland area man has been formally charged with arson after setting a fire at a parking lot attendant booth during a riot in downtown Cleveland just over a month ago. A federal grand jury has just handed up the charges against 19-year-old Timothy James Goodner after the fire at Shia's parking lot back on May 30th. The U.S. Attorney's Office says Goodner's indictment is one example of how acts of violence and property damage will not be tolerated. The criminal complaint states Goodner and others gathered around that attendant booth and used cardboard boxes and paper towels, then applied accelerants to light the building on fire. Goodner was arrested and booked into the Cuyahoga County Jail late last month. Some new details now on the number of jobless claims here in Ohio. According to the Ohio Department of Job and Family Services, more than 35,000 Ohioans filed for unemployment last week. Nationally, more than 1.4 million people filed unemployment claims last week. On the positive side, the unemployment rate dropped to 11.1% last month as the labor market added a record-breaking 4.8 million jobs. Governor Mike DeWine receiving some pushback with how he's handling the pandemic, and it seems the loudest voices of opposition are within his own party. Spectrum News State House reporter Josh Rotenberg has more.
When COVID-19 first hit Ohio in March, Republican Representative Craig Riedel from Defiance says he agreed with the governor's leadership. Riedel says that changed when businesses in his district were shut down despite only a limited number of his constituents confirmed to have the virus. Riedel says where I personally began to diverge was the middle part of April. I was one of the first to push back against the governor because I felt like the governor had taken things a bit too far and that it was becoming clear that the General Assembly was not going to be a part of the conversation. Also in April, Representative Scott Wiggum from Wayne County publicly undermined DeWine's authority when he and the rest of the legislature passed a bill to limit the state health director's power to keep things closed.
This bill ensures that the Ohio legislative body will not be effectively made mute and impotent during times of crisis.
In an interview, Geauga County's Diane Grendel also called out the governor.
If you look what we've done, the economy, it's devastated. And there's a third of the businesses won't be back, maybe more.
But in the midst of the pandemic, DeWine has received some unlikely allies, like Central Ohio Democratic Senator Tina Maharath and others from her party.
What he's proposing is not anything outrageous. It's things that's recommended from public health officials. It definitely puts the perspective that we do work in a bipartisanship matter here in Ohio.
Maharath says DeWine advocating for Ohioans to wear masks is an example of his leadership, especially given it's an issue President Trump doesn't mirror on the national level.
Even though it's a split decision between the president, he's not necessarily here to govern the United States of America. He's here to govern Ohio.
Riedel says there are three ways DeWine can better handle the pandemic. Be more confident in his messaging during his news conferences, de-emphasize the total number of deaths the pandemic has caused, and treat rural areas differently than big cities. Maharath agreed on his last point.
What happens here in Franklin County may not be the same as what's happening over in Benton County.
So as Republicans question the governor's leadership, they continue to push things to get quickly back to normal, even though there's no clear end in sight.
We need to get people to be confident. We need to get them to get out there again.
Josh Rotenberg, Spectrum News.
After months of being forced to stay closed, Kings Island is reopening to season pass holders today. Spectrum News 1 reporter Tina Bavenzi has the details on what's changed to keep guests safe while visiting the park.
Entering Kings Island looks a little bit different this year. Guests pass through a health screening station where they will have to answer a quick health questionnaire and pass a temperature test. Once you pass the temp test, you're free to enter the park, but immediately you notice some changes. First, there are no park maps. That all has become digital. Hand sanitizer stations and social distancing markers can be found all throughout the park. Kings Island Director of Communications Chad Showalter says Kings Island went above and beyond all safety measures for their reopening plan.
Kings Island's top priority has always been safety, and in 2020, this season, it's no different. And we found that when we focus on safety, our top priority, our guests can focus on fun.
The biggest adjustment for guests is adhering to wearing a face mask while visiting the park. Kings Island General Manager Mike Kuntz says he understands it will be an adjustment.
And I will tell you, it's not easy. It really is not easy. But, you know, to keep our associates safe, to keep each other safe, you know, face coverings are required at the park.
Masks are required while waiting in line and while riding the attractions, but there are designated areas where you can take the mask off.
We do have areas throughout the park, relax zones, where guests can go, as long as they're maintaining proper social distance, they can take their masks off and relax in the shade and take a break for a little bit if they would like to.
Face masks are also not required while dining at the park or while on water rides. Capacity in some dining areas will be restricted and is clearly labeled on the doors, as you can see here at Skyline Chili. Ultimately, Kings Island hopes to ensure guests stay safe while visiting the park. And Kuntz says people are excited to get back to Kings Island.
And they're just so excited, you know, to get to come back to the park, ride rides, eat the blue ice cream, funnel cake, enjoy Kings Island and what Kings Island has to offer.
All right, I'm sure there'll be some eager park goers there today. Again, that was Tina Bavenzi reporting. Another hot one as we head into the holiday weekend. Let's see what's in store for the rest of the day with an updated check of your weather on the One's forecast.
I'm meteorologist Erin Carroll. It has been hot, dry, and sunny over the past several days. In the next several days, it's going to be the same forecast. You know what that's good for? Boating. It's been really nice and calm out there. Waves 1 foot or less. Winds are out of the north, southeast 5 to 10 knots. Water temperature now on the west side up to 75 degrees. So weather headlines for us heading into that long holiday weekend. Clearly our big weather story is that heat. It's going to be getting close to the mid-90s at times throughout the weekend, otherwise some upper 80s, low 90s. But we are looking at some really dry skies, just a very low, slim chance, I'm talking 20% chance tomorrow afternoon for an isolated shower or two, because we're going to have a little bit of energy kind of dropping in from the north over the Great Lakes. So some weak energy, so 20% chance tomorrow. If you've got the outdoor plans, I think you're going to be just fine. Most of us are going to be dry and sunny. Tomorrow's going to look a lot like today. 88 out there this afternoon, so if you've got patio plans tonight, if you want to sit outside, kind of wait for the sun to go down, temperatures will still be really mild. We're going to be in the upper 60s through the overnight hours. Heading into tomorrow, we're looking at 89 for an afternoon high, more heat, sunshine, mainly dry skies. Remember, we have that about a 20% chance for an isolated pop-up. Notice the winds are out of the north and the northwest. There are two